Welcome back. It's Dr. Sandy Laura Cremers, one of the surgeons at Visionary Eye Doctors. Thank you so much for joining us for the EYE show. Please continue to send us your suggestions and your questions. We really appreciate you following us and subscribing to the channel. We are in Visionary Eye Doctors in Rockville, Maryland, so if you have any time to come visit us, please do. So today we're going to talk about the new drop that came out in December of 2021 called Vuity. This is a drop that's supposed to help you be able to see for reading without needing reading glasses. And this is not to be confused with Vivity. So this is Vuity. There is a Vivity, which is an IOL, an intraocular lens implant, that some patients sometimes get confused with. That's not what we're talking about. We're talking about Vuity. So this is from the company called Allergan. It's a pharmaceutical company. And essentially, we're going to talk about what this does. So Vuity, we're going to talk about what it contains, what it does, what it's treating, which is called presbyopia. We're going to talk about the risks of Vuity, the cost, and what I think about it. So this is pilocarpine 1.25%. Pilocarpine has been around for many years. It's a treatment that has been used for years, both topically as a drop to help with glaucoma, and also as a pill to help with things like dry mouth. So pilocarpine is essentially a muscarinic receptor 3 and agonist that is trying to increase acetylcholine. So it is not an anticholinergic like, let's say, diphenhydramine or Benadryl or that kind of thing. So it's trying to increase the kind of production of certain things in your body. So it's very helpful for certain types of contractions of the muscle, of the iris, and it's helpful now, it's been shown, of course, to help with one of the side effects when we were using it for glaucoma is that it would help people see for reading. So what it's treating is presbyopia. Presbyopia is the age issue, the natural progression. As we get older, the lens inside the eye, which usually is clear, is connected with these zonules that connect to the ciliary body of the actual, it's like a muscular structure that allows for accommodation. And so when we're trying to read, the ability of that lens to basically get thicker and thinner, it determines how well you can read. As we get older, that inner muscle, the ciliary body muscle, starts to not work so well, and you can no longer accommodate. That usually starts around the age of 40. If your eyeball is a little longer than usual, you have myopia, you have extra power in your eye. The idea is that the light going into an eyeball that's longer is focusing inside the eyeball. The light is not focusing on the macula. So by the lens trying to kind of accommodate, usually you can help a little bit with reading. And so most patients that are myopic can usually get by without needing reading glasses even into their 50s, sometimes 60s, depending on how much power you have in your eye, because it's as if you have a built-in reading glasses for myopic patients. So presbyopia is happening to everybody. Most people that don't need glasses for distance will notice the need for reading glasses around 40 years old, but a lot of people don't want to have it. So they're very excited about Vuity, and we're getting a lot of email questions and text questions about the Vuity drop, and so it does work. There's no question about that. We've had even different people here and the technicians trying it and the staff trying it, so it does work and it does what it says it's supposed to do. So the issue of Vuity is that it is pilocarpine. It has been used for years for glaucoma, and one of the biggest risks, let's talk about the risks of Vuity and pilocarpine, is the risk of retinal tear or retinal detachment. So if you look at the insert of Vuity, you actually look at what the company says. We're going to kind of go through this. It talks about how the risk of retinal detachment, retinal tear, is very rare. But it doesn't tell us how many cases have ever been reported on miotics associated with retinal tear and retinal hole and retinal detachment. So I went through this earlier, and it just basically says contradictions. Contradictions for Vuity is basically patients with known hypersensitivity to the active ingredient or any of the excipients. So it's basically just a negative. If you're allergic, don't use it. But it really doesn't tell you about the data with miotics and retinal detachment. And this is where there's an issue. Hold on. Sorry, George. We're going to cut that out. Sorry. Okay. So this is a bottle of 4% pilocarpine. And this is Vuity. We now sometimes mostly use like 1% pilocarpine. So We've done a study here with some of the technicians. You can check my Instagram where we had some of the staff use 1.25%, the Vuity, and the 1% pilocarpine. They had very similar abilities to read, very similar reactions. This is about $10 to $15 for about a month, and this is about $79 to $80 a month. And we love our drug reps and Allergan, and they've been helping us for years treat our glaucoma patients. They have wonderful glaucoma medications. But there's a problem here when this is, $10, $15 a month, and this is $90 or $80 a month. So the key issue we're going to talk about first is the retinal issue. Let me go back to that. So the retinal issue is this. So since 1978, this is the first paper I could find on the association of miotics with retinal detachment. And this is very controversial because it's thought to be a rare reaction. But in this paper, they talk about at least 100 cases they had noted from 1877, believe it or not, to 1978. And then they continue to follow it along to say, well, what's the association? Can we prove this? And so this is one of those things that is, you need a randomized controlled prospective study where one patient takes the pilocarpine in one eye and doesn't take pilocarpine in another eye, and we follow them over time, right? Or we do a control, the control eye or different patients. There's a lot of different factors associated with pilocarpine and the risk of retinal hole or tear, but it's not zero risk, right? So when I was a resident and when I was a young attending in Boston, we were told do not give pilocarpine to anyone that is a high myope, has a history of retinal detachment or retinal tear, or is aphakic, meaning they have a cataract surgery and there's no lens. Even patients that are pseudophakic, they've had cataract surgery and there's an implant put in the eye. So that has a risk. So if you have a retinal problem, you probably don't want to take Vuity. And you probably, if you have a family history of retinal problems, you probably also may not want to risk that, because what's going to happen, and this is going to become an issue guaranteed, is that you're going to have the association. So let's say I give a patient the prescription for Vuity, they had a small hole or tear we didn't see, and then they develop a retinal detachment. Well, it's going to be blamed on the drug, and even though it may not be the drug, there's that association which is hard to prove. So I definitely think Allergan should mention that contradiction in their insert right away, because this is going to become a medical legal issue. How do I know that? Because there's already been many medical legal lawsuits over this, and it's not so much proof, it's the association that's the risk. So basically there have been studies, and there's been some this is published, the amount of time between using a miotic and the symptom of retinal problem has been noted to be within as short as an hour to sometimes weeks or months. So the fact that somebody would take Vuity and start to notice more floaters or flashing, it's an association. We haven't proven a causation, but to be associated with that, or to be the prescribing doctor and not warn your patients about this, is a big issue. So technically, every patient that's getting a prescription for Vuity has to be warned about the risk of retinal hole and retinal detachment, and I don't think doctors are doing that. So we have to be very careful with that. Even though the risk is super small, I agree with that, because generally many of the cases of retinal detachment were associated with like a 4% or 5% pilocarpine used for many weeks, days, weeks, months. And Vuity is a much lower prescription, so that definitely is a less risk. But we don't know. We don't have the randomized controlled studies. So when they did this study back in 1978, this article, which I'll reference in my blog, they evaluated, they asked 124 retina surgeons what they thought about the risk of miotics with retinal detachment. And they got a 73% return rate on the questionnaire, and 80% of these surgeons felt miotics were a probable factor in causing some of the detachment. So this is many, many years ago. Have we made any progress since 1978? Not that much, because there's very little money in pilocarpine, or there was. But now when you talk about Vuity, and you say anything against Vuity, I'm learning, you have to be careful, because this is a multi-billion-dollar problem. So if I were you and you're thinking of Vuity, definitely first get a full retinal exam. Make sure from your family there's no retinal history of detachment. Some people don't tell their kids they had a detachment. You want to be very careful. You want to know about the options. So what are the options? Well, glasses, magnifier. Those are definitely, reading glasses are an option. So think about what you want to do in terms of the risk. Last thing I want to mention, there have now been at least since this is in 1978. At that time there were 3 lawsuits, and I'm sure there are more, where the problem was the doctor who prescribed the medication pilocarpine and the patients developed retinal detachment were sued because of they were not informed of the probability or the possibility, I should say possibility, of a drug-related event, and were not told of what symptoms to look for when they started using the miotics. So again, if you start using this or you know somebody that uses it, then you have to definitely be aware of the signs of retinal tear, retinal hole, retinal detachment, which are always the same. A burst of new black floaters, flashing lights always needs to be checked out, and of course any type of black curtain coming down over your vision or any unusual visual symptom has to be noted. So again, this paper in 1978, it's called Retinal Detachment and Topical Ocular Miotics by Beasley from Fort Worth, Texas. Basically noticed, they mentioned one of the lawsuits where it was a middle-aged woman who was given 1% pilocarpine in both eyes. That's less than Vuity. Noticed within 24 hours vision changes. Ended up having a vitreous hemorrhage. Eventually did poorly and obviously sued the doctors involved. And again, this is not a proof of causation. It's a proof of association. So the bad luck of this happening within 24 hours, maybe she was already set up to have the vitreous hemorrhage, but the fact she took the Vuity just a few hours before made it so close and the doctor didn't mention the risks that the doctor got sued. Okay, so just to kind of point out a couple last things here. So let's talk a little bit about how Vuity exactly works with the pilocarpine. So it is essentially causing the ora serrata. Let me just read this because it was well stated here. That kind of vitreous base I mentioned to you, that kind of ciliary body, as it accommodates the lens is starting to move. When you take pilocarpine, there's been studies now to show that the ora moves 0.05 millimeters when you're trying to accommodate. And so when you are using any thing like 1% or 2%, the posterior surface of the lens. So let me just show you one more time so you kind of understand what's going on. What's the problem here? So when this lens, your natural lens, kind of moves like this, even a 0.05 millimeter change pushes on the vitreous base. This is the gelatin inside the eye called the vitreous. That vitreous is attached to the retina. The retina is like that old type of film of your old type of camera that takes, you turn in and get the pictures back. When it's attached and you move it just a little bit, the theory is, and the concern is that you're pulling on the vitreous base, which is attached to the retina, and you're causing these little micro tears or holes, which can cause a retinal detachment. So a hole develops in the retina. The retina is essentially very complex structure of many tissue layers, which kind of look like multiple layers of saran wrap. It's very, very thin. And when the first layer of the saran wrap gets a tiny little hole, fluid gets in and divides the different layers of the saran wrap into multiple kind of pockets, and that's how you can get a detachment. And in the wrong location, it can be blinding. So that's not without risks. So that is the concern, is that this change in the accommodation caused by the pilocarpine, whether it's pilocarpine generic, Vuity, could cause that retinal hole or tear. And again, we don't have prospective randomized controlled studies. So my big concern is that there's going to be a lot of patients now noticing their eyes. Maybe they'll start noticing the floaters that they've had before, but they'll notice it because they're taking a new drop and then blame the Vuity, which we don't know. Okay, so basically the ultimate point of this paper was doctors need to tell their patients of this risk. There has to be an informed consent. Some doctors may even want to have it written because of their concern with this. But those are the key things that I wanted to mention about how Vuity works, how pilocarpine works, the risks involved, the cost, and ultimately, why are we paying so much for a drop which you could use reading glasses? So it's a lot about marketing, which I think, and so we did have a test in our office, which I did post on Instagram, where we compared these two. The headache was similar. That's one of the biggest risks of Vuity, is the headache that you can get. Both of our staff, we had 2 staff members try them both. They both had redness in both eyes when they tried this. So the risks of Vuity, again, the biggest concern I have is the retinal issue and the vitreous issue. So retinal hole, tear, maybe even more floaters. That's a big risk or concern. The headache is reported in 15% of patients, and we notice this before any type of procedure we use pilocarpine for. The headache will be a big issue. And then, of course, the redness. So the preservative is the last thing I'm going to mention, is basically here, BAK. So benzalkonium chloride, 0.0075%. We know that preservative over time affects the cells of the eye, the meibomian gland cells, the mucin cells, and maybe even the lacrimal gland cells. So we know preservatives are not good for the eye long term because they really do damage delicate tissues. So if you have dry eye, I don't really want people to use preservatives, as little as possible. So the punchline is my personal feeling on the Vuity. I highly recommend just reading glasses. If you've had LASIK before, there's a doctor I saw online mentioning that if you had LASIK, Vuity is a great option. The problem is that if you had LASIK, maybe you were a high myope, meaning you're -5 or -6 diopters or worse, which means your eyeball is already longer. You're already at risk for retinal hole or tear or detachment. Why would you add to that risk with something like this when you could just use reading glasses? So I don't recommend Vuity in most of my patients. I'm concerned about the risk because there's a big unknown. We have seen many patients that have had pilocarpine and have negative, headaches and things like that. We just don't know what it's doing to long term to the vitreous and the risk of retinal holes and tears. So my opinion is try not to use it. And I hope that was helpful. Please send me your comments. I know the Allergan reps will, but I just want to see if there's anything else I wanted to mention. Oh yeah, last thing I'll make a note of. There's one doctor talking about how Vuity is better because of the pH, something with a pH balance. Is it worth $80? I don't think so. Number 2 thing I want to mention is what can you do for when you're having issues with your presbyopia and reading besides reading glasses? Having a bright light will make your pupils smaller, so we like bright light, bigger font, holding the book further away so you can try to get a little bit more clarity when you're in the middle distance. So think about those things. So thank you again for joining us. Please pass it on to friends and family. If you know anybody thinking of Vuity, please send them this video. Please subscribe, and I'll see you next time.